know that every 20 seconds, someone in the world loses a leg because of a diabetic foot ulcer? And it usually starts with something as small as a blister. Hi, I'm Nurse Alyssa, a dedicated wound care specialist. Today, I'm going to show you how to properly care for a diabetic foot ulcer so you can avoid serious complications and promote faster healing at home. What is a diabetic foot ulcer? So let's start with the basics. It's a wound that forms because of two major issues caused by diabetes. One, nerve damage or neuropathy. This reduces your ability to feel pain or pressure, so a small cut or blister may go unnoticed. Two, poor circulation. High blood sugar over time damages blood vessels, slowing healing and making your foot more vulnerable to infection. These ulcers often appear on pressure points like the bottom of your feet or on the sides of your toes, and they can become dangerous quickly if not treated properly. Now let's walk through the basics of diabetic foot ulcer care at home. One, keep the wound clean and protected. Gently rinse the wound with sterile saline or a wound cleanser that has been recommended by your healthcare provider. Avoid using hydrogen peroxide or alcohol as these can damage healthy skin tissue. Always dry the surrounding skin carefully before applying any dressing. Two, keep pressure off the wound, offloading. Pressure delays healing, so staying off the foot as much as possible. Use offloading shoes, boots, or foam padding. Even walking around the inside of your home in your socks or barefoot can cause further damage. Three, choose the right dressing. So not all wounds need the same kind of dressing. The right choice depends on the wound's conditions like moisture, level, depth, and presence of infection. So let's go over the few common types. So gauze, it's best for simple wounds or a secondary dressing. It's inexpensive and breathable. Cons, it can stick to the wound and can cause trauma when you go to remove it. Hydrocolloids, they're best for light to moderate drainage wounds. Pros, it keeps the wound moist and does help to debride any dead tissue. Cons, it's not suitable for infected wounds. Hydrogels, they're best for dry wounds with dead tissue. It adds moisture and promotes autolytic debridement. Cons, it needs a secondary dressing and is not suitable for heavy drainage wounds. Foam dressings, they're best for moderate to heavy drainage wounds. They're absorbent, it cushions the wound, and maintains a moist environment. Cons, it can be bulky and may need to be trimmed down. Alginate dressings, it's best for heavily drainage wounds. It's super absorbent and made from seaweed and helps manage exudate. Cons, it does require secondary dressing and it's not to be used for dry wounds. Antimicrobial dressings, such as silver or iodine-based wounds. It's best for infected or high-risk wounds. Pros, it helps reduce bacterial load. Cons, it should be used under medical supervision. Quick tips, if a dressing is too wet or too dry, it can delay healing. The goal is to have a wound eyeball moist. Always make sure you do ask your provider before switching to a different dressing and never reuse an old dressing. 4, monitor for signs of infection. So redness, warmth, swelling, odor, or increased drainage can all be signs of infection. A sudden increase in pain is also a red flag, even when you have neuropathy. Don't wait on these signs. Always get it checked out right away. There is more to wound care than just covering it. Using the right dressing can mean a faster healing and fewer complications. The hidden key, blood sugar control. Here's something people often forget. Your blood sugar levels directly affect how fast or how slowly your wound heals. High blood sugar damages blood vessels, slows the function of the immune system, and increases your risk of infection. Even short-term spikes in blood sugar can set back your healing process, so be consistent with your medications, your diet, and regular glucose monitoring. Also inspect your feet daily. Look for new cuts, redness or swelling, warmth or tenderness. Catching the problems early is half the battle. So what happens if you don't treat a diabetic foot ulcer? Now, I'm not here to scare you, I'm here to empower you. But it's important to understand what can happen if you ignore a diabetic foot ulcer. So cellulitis is a skin infection that can spread quickly. Osteomyelitis is an infection in your bone. And ulcer deepening can make it harder for the wound to heal. And in really severe cases, even amputation. These outcomes are often preventable with early action. The sooner you take care of a wound properly, the better your chances of avoiding serious complications. Tips for daily prevention. Here's how you stay ahead of a diabetic foot ulcer. Never walk barefoot, even when you're at home. Moisturize your feet daily, but never in between your toes. Trim nails carefully or have your nails trimmed by a healthcare professional. Inspect your feet daily, especially if you have neuropathy. You don't need to be perfect, you just need to be consistent. And if you're unsure what to do, reach out to your healthcare professional. If you ever want more support, I've created a clear, easy to follow digital wound care guide just for people managing diabetic foot ulcers at home. Inside, you'll find step-by-step dressing instructions, when to seek medical help, a checklist of red flags to watch for, guidance on selecting wound care supplies. Plus, if you ever need personalized help, I also offer one-on-one Zoom consults to walk you through your specific situation. You don't have to figure this out alone. I'm always here to help. Links are in the description. But that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.